how do you pick what is the next disease you're going to tackle? Like, what an amazing ambition. And then how do you go after it?
Yeah, so most diseases, we're going for a burden reduction. Only very few diseases should you try to go for eradication because it's very, very hard to get to zero. And right now with polio, we're in Afghanistan, we're in Gaza, we're in Somalia, we're in DRC, and, we're having to execute high coverage vaccination campaigns against misinformation and violence in the toughest places in the world. So it's very, very hard. Polio's close. There's one called guinea worm, which is confined to Africa, where, President Carter just got to 100. So the magic thing that happened at the turn of the century was people got serious about global health, about really measuring, okay, kids die of diarrhea, but what caused that diarrhea? But even though there's no market, the people who die of malaria, 500,000 kids a year, it's not like you can make a business case of, hey, go to Silicon Valley and do a malaria startup and, look at that spreadsheet. The line that says life saved will look good, but the line that says profit will have a lot of red numbers because they can't afford these tools. So medical science is very distorted towards rich world conditions, and even amongst rich world conditions towards cancer and a few other things. So the incentive system is, potentially could be improved. But the Gates Foundation, that's our place we come to fill in, is that the things that aren't market driven, like getting diarrheal vaccines cheap enough for all the kids of the world, not just the rich kids who don't die of diarrhea, but that also used to be 500,000, now down to 100,000. So as we went from 10 million under 5 deaths per year at the turn of the century to 5 million, diarrhea was one of our best. Pneumonia, we got a vaccine out for that, which was a very expensive vaccine that we worked with all the vaccine companies, Western and Asian, to get those prices down. And so we're basically driven by the inequity, where we say, why do mothers die in childbirth 20 times as much in Africa?